doing an environmental check, my equipment that I'll be using, the environment around me. All right, and let me set my camera up. Let me put something there real quick. There we go. Okay. Alright. Entering the room, I'm performing hand hygiene. Hi, my name is Rebecca. I'm going to be your student nurse today, taking care of you. Who do I have the pleasure of speaking with today?
Blake.
Hi, Blake. So I'm here to do a head to chest assessment for us. So what that entails is I'm basically just going to be observing some things. I might be feeling with my hands the skin just to see if there's like any abnormalities, and then I might use a stethoscope, a pen light. Do I have your permission to proceed?
Yep.
Okay.
Good.
All right. I'm closing the curtain for privacy. Okay. So this is going to take about 15 to 20 minutes. And basically I'm just going to ask you a couple questions to begin, and we'll go from there, okay? Okay. Can I get your full name and date of birth?
Blake Bollius, 6/28/97.
Okay. And then I'm going to verify that with your patient armband. Okay. Good. Do you have any allergies, Blake?
Nope.
Okay. On a scale from 0 being no pain and 10 being the worst pain you've ever felt, where would you rate your pain?
0.
Okay. No pain at all?
Nope.
Okay. So can you tell me where you are right now?
In an apartment building.
Why are you here?
Doing a health assessment.
Do you know roughly what time it is?
About 10 o'clock.
Okay. So that I can say my patient is alert and oriented ×4. I can also state upon the assessment that he is not grimacing, he's actually smiling. So his behavior, his mood, and affect are appropriate to the situation. He is dressed and his attire is appropriate to the situation. I see no signs of acute distress. My patient is sitting, his posture is erect, and his breathing is unlabored. His speech is clear. When he spoke to me, he was able to answer questions I asked without hesitation. And so I'm just going to inspect the skin first. So noticing right off the bat that his skin tone is even throughout. The skin matches the ethnicity of my patient. I notice that there are macules on the face, neck, and the arms. I notice my patient has a bit longer of hair, facial hair, and hair bilaterally on the arms. I see no signs of hair loss. I'm just going to, does any of that hurt?
Nope.
Okay. You want to hold your hands out like that? Perfect. So I am not seeing any lesions or open wounds. No signs of cyanosis. Cap refill is 2 seconds. I am looking, are you able to move your, all right, range of motion is good. I'm noticing that the skin is warm and dry to the touch. If you will, lean your head forward. Good. So I'm inspecting the scalp, not finding any infestations. I do notate that there is some dander, but not much, not an extraordinary amount of dander. There are no lesions or open wounds. As I palpitate, I'm not feeling any masses. The head is normocephalic. I'm seeing that the facial features on the face are symmetrical, so eyebrows, eyes, nose is symmetrical, and to midline, the facial hair on both sides of the mouth, the labial folds are all symmetrical. Both ears on both sides are also symmetrical. Thank you. And then going, oh, you okay? All right. So then palpitating. Does any of this hurt?
Nope.
Okay. Okay. Was there any pain when I did that?
Nope.
Okay. So I'm notating that the ears, I'm not noticing that there's any skin breakdown. The skin is even toned throughout. I'm not seeing that there's any drainage. I am notating that there is some cerumen, some earwax buildup, but not much. I am palpitating. The tragus is intact. Did any of that hurt?
Nope.
Okay. So I'm going to whisper a word to you, and I want you to repeat what I say, okay?
Okay. Brown shirt.
Sorry.
Black chair.
So the two words that I gave were repeated, so that is showing a sign for no hearing loss in my patient. My patient also does not have any hearing aids in. So next I'm notating that the eyes are round. There's no drainage coming out from either side of the eye. I'm notating that the skin matches the ethnicity of the patient. There's no sign of hair loss in the eyelashes. My patient has eyelashes and eyebrows, no sign of hair loss there. I am notating that there is white sclera, pink and moist conjunctiva. If you will, look forward for me, okay, Blake? All right, the pupil, the eyes are, so I am notating that there is perla, the pupils size, the pupil's eyes are round, reactive to the light accommodation. So there is size accommodation when I shine the light into Blake's eyes. So that's good notation. So then I am looking at the mouth. I'm notating that there are no signs of cyanosis, no bluish lips. I'm noticing that there is a little bit of dryness, but not cracked lips. Blake, do you spend time outside, a lot of time outside?
Oh yeah.
Okay. Do you use chapstick when you go outside?
Most of the time.
Okay. So that tells me that Blake's lips are not cracked. He spends a lot of time outside, and there is a weather change right now that could be the reason for the dryness, the slight dryness in lips. If you will, open your mouth. Perfect. Blake has been talking to me, so I know. All right, perfect. I'm noticing that Blake has all of his teeth. The buccal-mucosa is there, and you can close your mouth. The mucous membranes are pink, moist, and intact. I'm noticing that that the lips, the mouth are pink and moist, intact, no lesions, no open wounds inside the mouth as well, and that there are tonsils in the back. My patient still has his tonsils. And next, I can see that the nose is symmetrical to the midline. I see that my patient, you will just breathe normal, okay? Just gonna take a look. Both sides. The nasal septum is intact. If you will, place one finger and breathe in and out. Alright, other side. I'm noticing that the nose, there's no deformities or inflammation. I'm noticing that with my patient, he is breathing unlabored, being able to use both sides of the nose, and that there is no drainage occurring outside of the nose. When I was able to look up, there's no piercing in the nose, and there is no sign of hair loss as well. So now we're going to move. So I'm going to just watch you breathe for a minute, okay? So just breathe normally. What I'm noticing right off the bat is that my patient is breathing unlabored. Can you take a deep breath in and out? No signs of kyphosis, scoliosis. Perfect. So the AP diameter is equal to transverse. Also, I'm noticing that he's breathing unlabored about 17 beats per minute. So the respiratory rate is about 17 beats per minute. I'm just going to take a minute and noticing that there is no accessory muscle use. And we're going to listen to the right upper lobe. So just take a deep breath in and out. The left upper lobe. The right upper lobe. I do apologize, I said that this was the left, so your right upper, left upper.
Gotcha.
There we go. And if you will, kind of pull your arms out, there you go. I'm just gonna listen to those middle lobes as well. Breathe in and out. The left upper. In and out. I'm hearing vesicular sounds, which is good. I'm also moving in a Z pattern. If you will breathe in and out. The right lower. And again. And the left lower lobe. And if you will turn facing this way so that I can just kind of see on camera. Beautiful. So, listening to the left upper. The right upper. Left upper. Right upper. Right middle. Right middle. Left lower. And there you go. And right lower. I'm hearing no wheezes or crackles. Sides are vesicular. Besides the confusion on my part, Blake, but the left lobes and the right lobes both sound good. You can face forward for me. So there is vesicular sounds, which is what I'm looking for. So next I'm going to just inspect and feel your carotid pulse, okay? Okay, on both sides. And your radial. I'm also notating that there is no sign of jugular vein distension. And that the pulse is strong. 2+ bilaterally. I'm also going to palpitate, so if you will. I'm going to be looking when I listen for murmurs. I'm not notating any masses. So I'm going to start with the second intercostal space, pulmonic. And the second intercostal space, aortic. And then I'm listening. I'm not notating there's any signs of murmurs. I can hear the S1 and the S2. The S2 is greater at Erb's point. I'm at the third intercostal space, Erb's point. Moving to the fourth intercostal space, the tricuspid. And the fifth, the mitral. Going back. So the first intercostal space, I'm the pulmonic, moving to the aortic, to Erb's point, tricuspid, and mitral. Alright, before my computer dies on me, that's recording me, everything looks and sounds great, Blake. Do you have any questions for me?
No.
Okay. So I notate that there were no murmurs heard. There's no redness or tenderness on inspection. Did any of that, was there any, so at the end of the assessment, I'm going to, on a scale of 0 to 10, can you rate your pain for me again?
0.
0 still, okay. So no inflammation throughout, everything looks great. And thank you for coming in. I'm going to place the bed back at the lowest position. I'm going to put the side rails up and lock the bed. I'm going to hand you this call light, Blake. That way if you need anything, you can call out.
Okay.
And is there anything you need? Maybe a glass of water or a warm blanket?
Not at this time. Thank you though.
All right, I thank you so much for allowing me to do this health assessment and participating for me, okay? And as I leave, I'm going to perform hand hygiene once again.